Assalamualaikum. How are you candidates? Today I am going to discuss with you many questions that you carry in your mind. Why I have not passed exam? What wrong I have done? Why that person passed exam? How he or she passed exam? What to study for exam? Where to study for exam? And which courses to attend and what to do and blah. Understand first thing that you have already done a lot in your lives, and post graduation is different from undergraduation. Just take a while and think that what you have done till now. You were selected for MBBS, you competed lot of people, you have done your undergraduation, you passed part 1, you have completed your training, your synopsis, your dissertation, your workshops and etc. each and everything, and even your theory exam also. And talks also. The only thing left is long case. So it might reduce your burden. And reassure yourself that if you have done all that, you can done this also. Why part 2 long case or theory is not passed? It's not your fault. It's not your brain that has stopped working. It's your circumstances, your preferences that have changed. Just think for a while that what are your priorities at this stage of life? The answer will be your family, your kids, your husbands, your jobs, your earning, your practice and many more. And at end comes your exam. So, first thing to understand is that your exam is not a priority now. In undergraduation, you might be distinction holder because at that time your only priority, your only responsibility, your everything to do was your studies, nothing else to do. But now you are supposed to do each and everything except studies. So, point here to understand is exam cannot be passed until you make it a priority. So the question is, your families, your kids, your jobs, each and everything is unavoidable, then what to do of them? So, at this stage of life, think that what are your priorities, what can be put aside, and how you can spare time for your exam. If you are having little kids and you can't spare time, no problem. Your exam can be delayed. What is best time to study for your exam? The best time is once you start your training. Immediately in training, you just complete your workshops, work on synopsis and IML, and you purchase or take your books what you have to study. I will discuss briefly about books you need to study for your part 2 exam is that you need to take at start of your training. Number 1 is evidence-based medicine. That is unavoidable. If you don't study that, you can't claim to pass your exam. Second is divorce. Third is guidelines. And fourth, you can take short and 10 teachers and short books, MCQ books, and that, etc. etc. So, start studying just a 1 hour or a single hour in your training. In first 6 months, if you study 1 hour per day, that is enough, as you have to adopt to new environment, your unit, your duties, your rosters. You are junior most and you have to do a lot in your guiding training also. And after 6 months, you just increase your time of studies, and in first 6 months just read your books. Don't try to memorize anything. In next 6 months, if you have gone through your books, then you just start second revision, and now you try to memorize things. And at the end of 1 year of your training, you must plan for your IMM. For that, you need to study your books and then short books, MCQs, and etc. etc. Once you have passed your IMM theory and talks, and your synopses have already been approved and your workshops have already been completed, and after IMM or before IMM, things vary, and in majority candidates after IMM, you got engaged, committed, married, or you became a mother of 1 or 2 or 3 kids, or etc. etc. So in last 2 years of training, your priorities usually change. Then what to do for that? You have studied for IMM, your books, whatever you have studied already, that's good. That is left, keep on studying that. And meanwhile, from start of your third year, just try to prepare one long case for a month. Even if you prepare one case, it's not to just present or whatever. Mean of preparing case means you know each and everything about case. You know how to present case, what is case, what are exam settings, what is protocol, time distribution, each and everything. If you prepare one case in a 1 month, then at the end of third year you might have prepared your 12 cases. And in total obstetrics and gynecology, if you prepare 10 cases of obstetrics and 10 cases of gynecology, you can easily pass your long case. And even in last 24 months, if you skip your 4 months, depending on your circumstances, and you prepare 20 cases and you have gone through your theory and your recommended books, then it will be easy for you immediately after completing your training to pass exam. And this is what format candidates follow, that pass exam immediately after completing their training. And what you and everyone else says, he or she is too lucky, she passed exam in first attempt, or he or she passed exam by chance, without studies, without preparation, as she previously last month completed training and now passed exam. It's not like that. It is that candidates that were organized from first day of their training, and they have done their things at time. But nothing is too late. If you have done this, not have done in your training, and now you have completed your training, you have passed your theory, and after, if you have not studied during your training, then you need 6 months complete, with or without job, for passing your theory exam and for your long case. Then, depending on your circumstances, your family, your kids, your job, you just Evaluate yourself that can you spare time or not. If you can't spare time, then don't destroy your life by this headache of passing exam. Just keep on studying slowly. You can skip your attempts, it doesn't matter, and until you have not passed your theory, as after passing theory exam you have total 4 attempts, 1 you can skip and 3 you can appear. And once your circumstances are favorable, you can prepare for your exam proper or by organizing yourself. As at this stage of life, your priorities are your kids. They need mothers. They don't need specialist mothers or doctor mothers or whatever. They don't need brands. They just need you, and you must be there for them until they are school going or little grown. But once you have analyzed your circumstances and you are prepared for appearing in exam, you must have 6 months free of pregnancy, free of peritoneum, and free of very little child. If you are in such circumstances, you can postpone your exam. After studying for theory exam, and once you have passed your exam, no matter you have prepared for your long case or not, then even nothing will change. Once you have passed your theory, sit back, thank God that at least you are now eligible for long case. And remember one thing, don't compare yourself from others or your colleagues or that people who have done training with you and they have passed exam and they are SR and blah blah. It just creates stress on you, nothing else. As everyone moves there on at their own pace, everyone's circumstances are different. It's not a competition that you had in your undergraduation that you have to take distinction, you have to top and this. And the beauty of CPSP is that they never mention your attempts on your degree. And even if you pass exam and your domestic circumstances don't allow you for a job, even then you will not be doing job or senior registrar or assistant or etc etc. So it will not change your life too much, and no need to sacrifice your important things for this exam. But once you have passed your theory exam, then you need to decide that now I need to study, I need to practice, and I have to prepare in long case. Preparation of long case, how you can start. Most important thing is, for orientation of long case, there can be your immediate senior, even a junior who have passed exam, your supervisor, your professor, or even a single course. I have seen many candidates that until they pass exam, they attend each and every course meant for long case preparation. It's not necessary, as long case courses give you orientation and you yourself have to practice for exam. So for orientation, one course is sufficient. That can be anyone's according to your city and your circumstances and whatever you think it's best you can attend. Next comes how to prepare. Long case cannot be passed without practice. Talks you pass, that are short stations, and that is what you do 4 years in your training. In long case, things are little different, as long case presentation is in standard circumstances that are recommendations or guidelines. But we do in wards, we never study books and we just follow seniors' advice, and we never ask them that why they have planned this and not that. So once you have taken guideline from anyone or any course, now you have to plan for your preparation. And for long case preparation, if you prepare and present 20 to 30 cases to a person who takes your case as on exam setup, it is sufficient for you, as now you need nothing to study for theory, you know each and everything already. So once you have taken guideline, you find some partner for long case. Both of you go to ward, find a patient from there, take history and start practicing on exam format that you have to take history and examination in 15 or 16 minutes, and then you have to ask investigations that you will ask from your colleague, and then you have to present case in 8 minutes and then discussion in next 22 minutes. And one hour for one candidate and 1 hour for the second candidate. You can take the same case or the different. Then after completing 1 hour case discussion, you just analyze yourself that what mistakes you have made, and after that you can go to homes, just give time to your kids and families or your jobs, etc. And meanwhile, the remaining 22 hours, you just keep on thinking in your mind that what mistake you have made today, what you have missed today, and how to rectify that, and you just try to memorize things related to that case. It also depends how many times and how much time you must prepare one case. If you are having much longer time, 6 months or 3 or 4 months, then you can prepare one case in a 1 week and then keep on thinking, repeatedly assessing patient related to that case. And if it is short time, 1 week or 2 weeks, then every day you have to do a new case. And after doing this, the most important thing is, once you both have discussed your cases, then you need to present that case to anyone who have passed exam. That can be your immediate junior, immediate senior, your supervisor, your professor, or whatever, whoever is available to you. After presenting case to that person, then analyze yourself that what was actual plan to be made for that patient, what you decided for that patient, why you have not thought in that way the other person thought. And the remaining time of the day, just keep on thinking and analyzing and memorizing all these things. And next day, you spare next 2 hours and do the same practice. If you do this continuous 2 weeks or 3 weeks or 20 or 30 cases, it is enough for passing your long case. The most important thing I want to say or I want to discuss here is why candidates don't pass or can't pass exam. You are busy in your other activities and you need shortcut to exam. You just think that if you open Facebook, someone might have posted questions and answers, and you just go through that and you will pass. It's not like that. For Facebook or for any group, you can choose a single group, not to join each and every group, as these groups are a source of wastage of time, and you just keep on looking at that and you review all comments, suggestions, true or false or whatever, and you don't know the actually real answer. And the way how to utilize that group is, you just, if you are preparing for theory, you just go through the STEM, refer back to your book, open your book and find answer for that or study that topic, as the MCQs posted in these groups are not complete and the answers are sometimes different too and not true. So it's best way that you just go through the STEM and then study that topic from book, and your that topic will be prepared, and if any MCQ comes in exam in either way, you will be knowing the right answer. And don't try to memorize answers posted in that groups. And for long case or Viva preparation, also don't waste time by finding that if you have joined 2, 3, 4, 5 or multiple groups and someone's case presented and you are following that, you will pass exam. That can be informative to you, that can be beneficial, but there is no shortcut to practice. You need to practice your exam, you need to present your cases, and even you cannot generalize things what were discussed in that case, and things vary from case to case, from patient to patient. So once you yourself present your case, then you actually realize that what are your deficiencies and what stage of preparation you are and how much time you need to prepare for your exam. And most important thing I would like to add here, that if it is your third attempt of Viva or last attempt of Viva, kindly do analyze yourself day or two before appearing in exam, or you can ask from someone whom you are preparing. There is no harm of asking that are you prepared for exam or are you confident that you can pass exam. If you are not confident, then don't sit in an exam just saying that sometime by chance people do pass and it is possible that I might pass. It's not like that. As examiners are also humans, everyone is answerable. And once you fail that attempt, then you have put yourself in a trouble of re-study for theory exam also. So don't get depressed if you are not passing your exam. Don't get panic and don't waste your attempts. If you are not prepared, just skip attempt, as one attempt you can skip, and in last attempt you must realize that are you confident in your preparation or not. And one thing I always say, that it is exit exam, and once you pass this exam, your future possibilities are, if you are an MCPS or FCPS or MS candidate, even you can be head of departments at DHQ, THQ and FCPS, MS, you can be professors and PhDs. So don't try to be a stupid consultant. study things properly, prepare for exam properly, and it's far much better to fail your exam once, twice, or thrice than killing mothers. As if you have left your kids for some time, for 6 hours or 12 hours or 2 hours a day, still you are with your kids. But if a mother dies because of your lack of knowledge, that kids will never find a mother again. These words might be hurting for someone, but it truly, really makes a difference. And in your professional lives, you might have never seen a consultant who is not knowledgeable, who has no conversation skills, communication skills, counseling skills. So it's a certificate to you to decide the or save the lives of mothers, not a certificate to kill mothers. So failing exam is not end of life. Just take your time, prepare your exam properly. And the one beautiful thing I remember of one of my senior assistant professor, that she repeatedly used to say that doesn't matter you have passed exam in first attempt or fourth or fifth or eighth attempt, what matter is your market value after passing your exam. What does market value mean? That is how knowledgeable you are, how confident you are in deciding your patients, and how compatible you are with following guidelines and each and everything. And if you have not studied properly and you have not gone through things properly, then even if you mismanage a single patient, then you will put yourself in trouble, and that trouble might not end till your remaining profession, and you will lose your confidence. And this was the step where you have to start flying. Your wings will be cut even before you start flying. So you have to prepare, be well prepared to fly. Then you need to prepare your exam in a proper way and pass exam and be good consultant, be a good gynecologist, be a good obstetrician, and be lifesavers, not killing mothers. I hope this will be informative for you, and if I might have used some words that may be inappropriate or you don't like, and these words look very hurting once you have not passed exam, but after passing exam you will realize that these words were not wrong. Take care of